Welcome back to the Now Morning Show. This morning on Now, of course, we are observing May, which is Mental Health Awareness Month. And joining us is Dr. Lesley Garcia, the founding chair of the Trinidad and Tobago Occupational Therapy Association and an occupational therapist. Good morning, Dr. Garcia, and welcome.
Good morning. Thank you for having me.
It's a pleasure to have you with us on the show. Thank you for joining us this morning. And thank you for also, of course, bringing this critical conversation to the fore, because many of us will know somebody who has in some form or fashion been adversely affected or a family member by dementia. And it is a conversation that we don't usually have, specifically around caregivers. Very important. But before we get into that, let's unpack the stigma around it from your experience. What stigma do you see attached to it in Trinidad and Tobago?
Okay, great. Thank you so much for inviting us. The Occupational Therapy Association is really happy and glad to address the topic of dementia. It's often confused as, well, it falls under a neurological condition, but of course there's mental health features associated with. But people are often quite afraid because there's no cure. It's progressive, so people will decline over time. And it can be frightening. Yeah. So it's something that people are afraid to talk about, somewhat embarrassed, because it involves cognitive skills and mental capacity. There's sometimes some stigma around is it just being crazy? Are they going mad? Are they possessed? Those sorts of ideas that are really not scientific.
Yeah, I was just thinking that.
For one.
Yeah.
But understandable in ways that people want to cope. But it's dementia research and dementia care is almost sort of where cancer was 20 years ago.
Okay.
Where we couldn't say the word, and you couldn't say, there's so many things like cancer, mental health, menopause, where it's freeing to say the word, and I think we should speak about dementia and neurocognitive changes that are abnormal from normal aging. It isn't an automatic thing that you get old and you're going to get demented. It's a neurological condition that research and science is trying to find treatment for. And in the absence of a cure, there are interventions that can be done with psychology, occupational therapy, and training that can be given with to caregivers to support family members.
So before we get into that particular part of the conversation, which admittedly I think is, again, something unexplored for many, unfortunately, so we can start that this morning. Let's talk a little bit about us in general as a people. Is there anything we can do to be preventative and lower our risk of dementia? Because as you mentioned, it's not something that automatically happens, and that's already a stigma that's attached, because people do think, oh, as soon as I get older, I'm going to get dementia. So what can we do from now to protect ourselves? Right.
Well, there's good news. There's at least 40% of the risk can be managed by lifestyle changes. So simple things in midlife are things like reducing smoking, reducing alcohol intake, managing diabetes, continuing to be active. Those are, so the things that are good for your heart are good for your brain as well. They've also, the Lancet Commission, which was just updated in 2024, found there's actually 14 lifestyle conditions, lifestyle factors that can be changed, including checking hearing, checking vision, and then in the older ages, in later life, remaining socially connected. Being isolated has been found as a factor that can be increasing risk of dementia. So what can we do as people? Keep your elderly family and friends involved in activities, remain socially connected, challenge yourself, continue to do the cognitively stimulating activities, but also just stay fit, stay healthy. Lower cholesterol is another thing. Everything that's good for your heart is good for your brain.
You know, Lesley, it's interesting as you mentioned that particularly. We're speaking about physical fitness, but also cognitive fitness as well. And one thing we've seen an increase over the past, let's say now, 20 years or so, are the use of devices, whether it's computers, iPads, phones, that sort of thing. Where does that fit into, let's say, helping with cognitive function, if it does at all? Because there's definitely, you know, some back and forth over how good these devices are for you.
Right. That's a great question. And in the world of intervention and research, technology is being explored as a way to help people cope with memory loss. So people can use devices to just support cognitive function. So we do it on a daily basis. It's called cognitive offloading.
Okay.
So anything that helps you with your calendar, reminders, anything that will help you keep connected. So using WhatsApp, using FaceTime, the things that keep you socially connected, keep you continuing to do the things you enjoy doing. So listening to books if vision is failing, doing the crosswords. So using technology to help you in a positive way is a good thing.
Okay.
And for older people who aren't familiar, learning to use technology with support is also a good thing, because it comes under the learning something new.
Yeah.
And then technology is also being used as a way to do telehealth. So if you need to get therapy, you can get it through telehealth more and more these days.
Lesley, what about routine and structure? Is that something that should be implemented, or is going to make living with dementia easier, not just for the individual who's living with it, but for the caregiver as well?
That's an excellent question. So that's all about occupational therapies, because we're all about how do you occupy your daily life? How do you occupy yourself? Routine and habits are extremely important. They are the pillars around which people structure their day. So for a person with dementia, in the early stages or in the middle stages, the family or the caregivers want to make sure that they engage in the activities that are important to them, that bring them a sense of accomplishment, that make them feel needed, that give them a sense of dignity. So all the things, the passive activities, the active activities, the things that you do by yourself, and of course those things should be graded, meaning they should be supported more and more as the condition progresses, so that people can continue to engage. So for example, if somebody enjoys cooking, you want to be able to continue to support them to cook. And if they need to do fewer steps, that's fine. Allow them to do the safer things. If they need to sit, let them sit. If you need to do the things that don't involve knives and stoves and remembering, then you can support that as well. Yeah.
Now, coming out of that, unfortunately, there is also another side to this, which is the frustration of the person who is living with dementia, but also the frustration of the caregiver, particularly. So let's shift the conversation a little bit there, because at the end of the day, we're all human. And having to deal with things repetitively can be a challenge. So what are some practical tips that you could give a caregiver when it comes to balancing their life particularly, and also managing their own mental health?
That's so important. So in dementia care, we consider the team, the triad, the professional, the person with dementia, and the caregiver, which is extremely important. That's the team. The person who is a caregiver, which is usually either a spouse or an adult child, or sometimes a paid caregiver or an unpaid caregiver who's responsible to be with that person, that person should never be fully responsible 24/7. No one can do it, because it's emotionally challenging. It's cognitively and emotionally challenging to be present, which is what we want the caregiver to be, for 24/7. So as much as possible, caregivers need to seek support. They need to either reach out to family or friends or professionals to help them learn the skills, because it's not something that everyone knows automatically, to learn the skills of how to communicate with someone with dementia, how to help them engage with what they can do and on what their strengths still are, but also the caregiver needs to be able to say, I need a break. I need to be doing my own thing as much as possible. And I know it's sometimes very difficult to do, especially if it's a family member, but to be able to be the best spouse or adult child, you need to have your own time as well. So there are day centers in the community. There's the activity day centers that the different communities like TARP have started some day centers. These cost money, a lot of them, but hopefully we will have enrichment centers and more things that are available for people. But a caregiver really, even if it's something like take the time to go and have a shower.
Yeah.
Take the time to have a cup of tea. It's 15 minutes to have a shower. That's maybe as simple as something like that, to just center yourself, because you don't want to be the person who then has the high blood pressure and the complications that come with caregiving, which we know too well can happen.
Definitely. And as you mentioned, complications, particularly one thing that we do see many times, depending on, of course, how your house is set up, is there could be an increase in accidents and so forth within the home when you are taking care of somebody. Do you have any recommendations for those who are living or taking care of somebody with dementia as how to minimize this risk?
Right. So with dementia, there can be visual perceptual changes. And because dementia tends to be people who are older, although there is young onset dementia, people under 65, anything that is a falls prevention measure, so good lighting, proper lighting, hazards on the floor, the usual things that you would do that an OT would recommend for falls prevention in a home, would be appropriate. The only difference with dementia is you don't want to change up the house and remove things that are markers for the person. So you want to balance familiarity so that that person has their muscle memory. They know the way from the bed to the bathroom. The lighting is good. There's no trip hazards, yet things are familiar. So the thing about having early detection of the condition is families can prepare. If they know we're dealing with dementia, then the changes can be made while the person still has as much strength cognitively to adapt as soon as possible for what's coming down the road.
Definitely something, of course, coming together and working towards it, and also having the conversation with that family member to understand what's going to be happening and what may happen as well. Working together is so important. Now, I know very briefly you did mention off air, there are memory clinics. Can you walk us through that and also some of the other resources that may be available for family members? Yes.
So in the public sector, in the RHAs, we now have memory clinics. The last one was opened in 2022. On Pembroke Street, so it's free. I think I just did a quick check, and the clinic days for memory clinics is on a Tuesday, so you make an appointment, you go. I think for people who want to check, diagnosing dementia takes time. So people first start to see, oh, something's not quite right. There's no blood test or biomarker for dementia. It's a rule-out diagnosis. So you go to your doctor. You want to rule out other things. It's not an infection, delirium, it's not a tumor, it's not anything else that's causing the behavioral changes that may alert a family member. And then the doctor will rule those things out, and then you will have some memory tests, psychiatric tests that will happen at the memory clinic. And then from there, there'll be referrals to therapies as appropriate.
And speaking about therapies, before we close our conversation, where can those who are interested get in contact with the Trinidad and Tobago Occupational Therapy Association?
Right. So we have a website, and it's ttota.com. And under the website, there's Contact Us. You just go under Contact Us. There's a full list of all the registered therapists in the country, and they're all licensed under the Ministry of Health. So you just go and look, and the list is there by geographical location and by practice area, and you just call up an OT and get referred to an OT, and we can help help family members and the person with dementia navigate this journey.
Wonderful. Well, Lesley, thank you so much for joining us this morning. It's been an absolute pleasure.
Thank you so much for having me.
Of course, Dr. Lesley Garcia, occupational therapist and founding chair of the Trinidad and Tobago Occupational Therapy Association, with us this morning on Now. Stay tuned. There's more coming up after this break.